Aklief Cream is a prescription medicine used on the skin, topical, to treat acne vulgaris in people 9 years of age and older. Dosage and administration. Apply a thin layer of Aklief Cream to the affected areas once daily, in the evening, on clean and dry skin. One pump actuation should be enough to cover the face, forehead, cheeks, nose, and chin. 2 actuations of the pump should be enough to cover the upper trunk, reachable upper back, shoulders and chest. 1 additional pump actuation may be used for middle and lower back if acne is present. The use of a moisturizer is recommended as frequently as needed from the initiation of treatment. Avoid contact with the eyes, lips, paranasal creases, mucous membranes. Aklief Cream is for topical use only, not for oral, ophthalmic, or intravaginal use. Who should not take this medication? Do not take this medication if you are allergic to Trifarotene or any ingredients of the medication, are pregnant or planning to become pregnant, have eczema or seborrheic dermatitis. What are the possible side effects of Aklief Cream? Local skin irritation. Local skin reactions are common with Aklief Cream, are most likely to happen during the first 4 weeks of treatment and may decrease with continued use of Aklief Cream. Signs and symptoms of local skin reactions include redness, scaling, dryness, stinging or burning. To help reduce your risk of developing this local skin reaction, when you begin treatment with Aklief Cream, you should begin applying a moisturizer on your skin as often as needed. Are there any other precautions or warnings for this medication? Before you begin using the medication, be sure to inform your doctor of any medical conditions or allergies you may have, any medications are you taking, whether you are pregnant or breastfeeding, and any other significant facts about your health. These factors may affect how should you use this medication. Pregnancy. It is recommended that pregnant women do not use Trifarotene. Breastfeeding. It is not known if Trifarotene passes into breast milk. If you are a breastfeeding mother and are taking this medication, it may affect your baby. Talk to your doctor about whether you should continue breastfeeding. Children. The safety and effectiveness of this medication have not been established for children less than 12 years of age.